Is it accurate to assume that infertility is a woman's problem? Let's find out. I'm Dr. Wilshire. I'm a board-certified reproductive endocrinologist, and I've helped thousands start their families. Today, we're going to talk about male factor. Sometimes the reasons for male factor problems are mysterious. Frequently, we have a very good idea, however, why we have a problem. Men are exposed to toxins on the job, in the environment. Sometimes we have habits such as drinking, chewing tobacco, smoking, etc. That can also affect male fertility. Obesity, terrible diet, these all contribute to possible male issues. Men can also be born with problems. Men can have undescended testes. Sometimes as a boy, a young man will have a hernia surgery and doesn't realize that can affect his fertility. Sometimes there can be more subtle issues such as a varicocele. These can all contribute to male factor problems and infertility. Remember, this is not a blame game. We want to find out what the problems are so we can solve them. Male evaluation almost always begins with a semen analysis. If moderate issues are found, generally lifestyle changes, changes in nutrition, supplements, other health improvements, weight loss, etc. can usually result in improved semen parameters. Generally, we see this in about 3 to 9 months. If more severe issues are found, generally we'll do blood tests looking at hormone levels, and sometimes if a very severe issue is found, we'll do some genetic testing as well. If we think there's anatomical issues, or if issues are more specialized, we will send you to a very special urologist. Not just any urologist, but a urologist who has special training in male infertility evaluation and treatment. A very important point here. If, men, you have had a vasectomy, I beg you, do not get it reversed without talking to us first. Sometimes a reversal makes a lot of sense. Sometimes it's a big waste of time and money, and you will regret it. Make sure you come to us, talk to us about your problems. Let us evaluate both you and your female partner. If vasectomy reversal makes sense, we're very happy to send you to get that done. A final issue I'd like to discuss is age. As men get older, their fertility does decline. An otherwise fertile man at age 40 does experience a small decline in his sperm numbers. At age 50, numbers can fall precipitously, and by the end of a man's 50s, most of the sperm can be genetically abnormal. This can come as a surprise to some couples. We see this most frequently when an older man marries a younger woman, perhaps on his second marriage. The man may have older, perhaps adult children, and they've always assumed that he was still fertile. Unfortunately, this is not always the case. We can usually help these couples, but sometimes it can be more serious than you might believe. So this is an important issue, something that we'll always talk about when we evaluate you. I hope this discussion of male factor issues was helpful to you. We could talk for hours about this, but we hit the highlights of the most important subjects that you might find valuable. I hope you found this helpful. Please feel free to like and subscribe below. This is Dr. Wilshire at Missouri Fertility, Columbia, Missouri. Thank you very much.